Okay, thank you for joining me. If you're watching or watching this later, thanks for taking the time out. I had a little hiccup because I'm streaming in Facebook Live now, and I think it's putting too much strain on my computer. So we'll see how the quality goes. But today I wanted to touch on some great research. There's a ton of research which I was just looking through, and I thought I really should jump online and share it with everyone who's interested, with all the data back with 2020 COVID and gaining along the years, and here we are in 2026, and what does it say? And I want to share that with you. I'm also going to share a look at on this page with the data with the vitamins and the minerals and the herb research at that time as well and now, and what does it mean for long COVID, general immunity, other viral agents. Also, I'm going to show you about the countries and the cost of treatment, and just let's look at that and what can we do for the future regarding that. And so let's jump over to my screen here. I wonder if I can actually just put my picture in the corner there, just to be present with you there. Just bear with me while I do this. Let's put myself over there. And then let's look at this screen here. So here we've got a great resource. Now, I was using this back in 2020, and it's just for your information. You can type it in, but don't type it in now. I'm going to show you through it, but it takes a lot of hours to go through it all. But it's c19early.org, c19early.org. But this is the landing page, and the studies keep growing, but we've got 6,545 studies. There's a lot of studies there. They're broken up into different areas. Now, just these top ones, you can see effective. So nasal pharyngeal treatment, spraying salt water, colloidal silver, etc. like that, it actually is effective. Now, sure, this page is about COVID-19 treatment, but we can use this information for other viral agents or infections too. Healthy lifestyle was protective. Immune support, things like vitamin A, C, D, and zinc. The evidence shows a reduced risk. Thermotherapy, particularly increasing the body temperature. So this doesn't look at things like Wim Hof and cold therapy, but heating the body with saunas, triggering like a fever response. Personally love doing that. It often gets me over the line and gets me healthy again. Systemic agents and other things were not helpful. So high profit systemic agents, and this ties in with my last bit that I'm going to touch on about countries and how they varied in treatments through countries. And we need to take some learning out of that page of the book and think, if there's ever another virus pandemic, these big dollar value things were actually causing more harm. Now, on this page up here, there's different tabs, but because I'm always talking about long COVID and chronic fatigue and all of that, let's just jump straight to the long COVID. Now, this is not extensive list. This is what they have research on for these agents. So if we pick something at the top for long COVID, vitamin A, I'll click through to there. There's over 20,000 patients with 14 studies specifically for vitamin A, or they include vitamin A. Now, all studies, these blue numbers, it was effective 33% of the case. Now, a lot of people might say, well, that's not 100%. That's not worth anything. But if we go back to that naturopathic model and think about synergistic effect and combining treatments, you're not just using vitamin A. What about if you throw in there some vitamin D, sunlight, diet? You get the picture, right? So 33%, it is statistically beneficial. And here we have against the control is definitely effective, significantly lowers the risk for hospitalization, recovery cases. Now down here we've got all the data, but the latest one, this is top one, is just a summary, but February 28th was the last one for COVID infections, with including vitamin A. Let's click through there just to show you. But they do often combine the vitamins, but vitamin A was effective here. I'll just go back there. And now I'm just going to pick a few natural ones that you might be interested in. I might look at the pharmaceuticals at the end, but probiotics, this is the improvement percentage, 68%, always talking about the microbiome health and how's your intestinal permeability. And the probiotics are that really important T helper cells 1 and T helper cells modulator to reduce that histamine reaction that was happening. Ivermectin, I'm not sure if you know about it, but there's so much data out there now with that. But obviously a pharmaceutical. Go down to vitamin D, 40%. Now back in, I was using this and I'm streaming on Facebook, and I got banned for information that was misinformation, but I was talking about vitamin D being an effective agent, and I'm not talking about misinformation, I'm talking about science. And here it is right here, published articles, March 23rd. But let's go right back, look at all those studies. Wait, what does it say at the top? Over 190,000 patients, 137 patients just for vitamin D. So let's go all the way back, 2025, 2024. Scrolling down, let's just go to the edge and scroll. There's too many. Now, I'm not saying I told you so. I just want to make a point of the importance of these of evidence, and important of just discussing it and looking at the data and questioning, can these natural agents be a benefit for autoimmunity or infections like COVID? So here, June 19th, 2020, specifically COVID-19, we've got all through 2020. There was, just in 2020, there was a ton of evidence, and it was showing it to be beneficial. And then as the research goes on, 2021, 2022, it was just compounding that it was beneficial and still is beneficial. So if you're watching this, COVID's long gone, done. But as I say in other videos on my YouTube channel, or I'm talking with patients, talking about boosting immunity and getting over infections, whether it's Lyme's or whether it's autoimmunity or whatever the case. How about we combine some of these tried and tested therapies, and synergistically we don't need to isolate what specific virus, whether it's Epstein-Barr glandular fever, but why don't we use these, combine them together synergistically and boost your immune system and your ability to overcome and recover faster. So let's go on to a couple of others. There's curcumin from turmeric. Look at that, against control, 28 studies, over 15,000 patients, beneficial. 41% for all studies. Mortality decreased 63%, hospitalization 27%, but I'm always saying prevention is better than cure. Think about what you could do rather than just waiting for you to get an infection and taking it. What could you do if you took it consistently, and think of an approach of prevention and keeping yourself stronger and healthier all the time. Viral clearance, 37%. Recovery, almost 40%. And there's some random control studies there in all of these as well, if you want to click through to those, if you want to dig deeper in the evidence. A lifestyle there, simple things like diet. There are studies on diet. Mortality 20%. We could look at pictures like diabetes, morbid obesity, or whatever. How much is that change in diet going to have an effect? Prevention is better than cure. Always stressing that to patients. How about you just start now by tidying up and having the best diet you can to improve your health and wellness and everything. And the study and the research here is showing that diet, most definitely, all studies, 51% improvement favors healthy diet to control. It's going to reduce your hospitalization, ICU, progression of illness, recovery, and viral clearance and the cases. So even just getting it. Let's look at something like sunshine. Love talking about sunshine, and not sure if you've heard of Dr. Cruz, Jack Cruz. He's a big one for it as well, and a lot of evidence coming out with the importance of the blue light blockers. Oh my goodness, I don't have my glasses on. I'm not going to sleep well tonight. And getting in the sunshine and grounding. But 37%, you're never going to just purely only do sunshine. You're going to combine it with other therapies too. Now, minerals, they've only looked at selenium and zinc. But what about magnesium? What about calcium? They did talk about iodine. Sodium, neti pots to wash your nose. Have you tried that? 1,000 patients. It's a fair amount. I'm not sure if you ever use it, a neti pot, or there are a few brands at your chemist or pharmacy. But 9 studies showed, it's somewhat beneficial, around 20%, 30%. But if you really want to get better and you're willing to try whatever it takes, I would do saltwater nasal washes, or try sodium bicarbonate. A little bit more effective. Such a simple thing in your cupboard. Reduces mortality. Hopefully you never get that far gone. But hospitalization, who wants to wait in the emergency room? Who wants to get into hospital? I would do everything I could to stay out of hospital. And recovery, it's going to help. Let's look at some herbs. There's black cumin, which is Nigella. This was an early one back in 2020. I was giving a protocol for preventing COVID with patients, but over 3,000 patients. Unfortunately, there's not as many herbs as what there should be. Here there's some, there was turmeric, but black cumin, for some reason, it had a spotlight shone on it. 14 studies with 3,000 patients. It is effective. 43, 50% mortality always comes up, but recovery 64%. There are so many brilliant herbs, and it's such a shame they're being overlooked. Viral clearance, and they were being overlooked during the last 6 years, but particularly in that hot zone of stress that the whole globe got. Please, if it ever happens again, please go and look for alternative things, complementary things like these beautiful herbs, because they do have evidence. Now, I'll just show you a couple. Now we'll start to get into some things that you might be taking or a family member might be taking, and they're actually not beneficial. This one here is a pet peeve of mine, protein pump inhibitors. Now, what are they? They're the medicines that you take for reflux. Look at this, it's negative. So against control, protein pump inhibitors are actually causing more illness in this particular scenario of viruses and sickness and COVID-19. Now, I'm not just please don't take me off this stream or ban me or say it's misinformation. I'm just looking at the data. And the latest one, February 24, was done, the resistance paradox in COVID-19, ventilator-associated pneumonia. Now, if we just think of the mechanisms of a protein pump inhibitor in the digestive system, someone's got reflux, sure, it's uncomfortable, the acid's coming up, but a protein pump inhibitor is switching off the acid in the stomach, and the residual effect of that lasts somewhere around 3 months after stopping that medication. So what does the acid do? It obviously digests food. It's uncomfortable, but let's put that aside. What is it doing? It's first line of defense, innate immunity to protect against infections and anything that we breathe with us in with our saliva, some bacteria, or we touch our hands or whatever the case, and it dissolves that and then doesn't go any further. So when we switch off the acid, we don't have that first line of defense in our digestive system. There are other complications as well, because mineral absorption and vitamin absorption is affected. We don't get the maximum amount of vitamins and minerals out of our food digestion. We don't assimilate those as effectively, and we can get into naturopathic, deeper stuff to do with our immunity, our bowel motility. But the question is some people might be saying, but I need them, I've got acid reflux. So my question is why do you have acid reflux? And then we've got to get back to prevention is better than cure. So before we get sick, before we need to take the protein pump inhibitors, could we do something else like sodium bicarbonate, or could we take some herbs? Could we look at fiber? Could we look at dietary changes? Because definitely some foods like tomato will exacerbate, and alcohol and coffee will exacerbate reflux. But just purely as a infection, COVID-19 virus health thing, this protein pump inhibitor was making things much worse. So if someone was in hospital and they were taking that, it was making it worse. Now I'll just go to I think there was masks somewhere. I can't see that anymore. Must be more masks. Here we are. So masks. I have a pet peeve with masks. I hope that you're not wearing one, because these studies were kind and saying that there was a 2% benefit. With exclusions, it is even worse, but there is no significant improvement as seen with meta-analysis to date. Masks don't work. It's using a chain link fence to try and stop a piece of sand getting through. If anything, is making it worse because it's trapping all of those mouth bacteria. It's dehydrating, oxygen levels are decreasing. Unless you are a surgeon or a dental practitioner and you don't want to get a droplet of saliva into someone else's mouth or open surgery, then you don't need to. You should be getting into the sunshine. You should be getting as much fresh air as possible. Out of 4 studies with more than 300,000 patients, it suggests that it doesn't work. You might say that there's not enough data. I should have brought up other articles on this particular point. It's not included in this one, but there is actually more evidence showing that masks don't work. Now, the other thing that I wanted to show in this stream, on this page, is the global adoption of COVID-19 early treatments. Now, I love this page because it makes it so easy to see the data. And when you can see, rather than reading through streams and streams of raw data, it's really challenging. This one pulls it out and puts it into beautiful visuals to make it easy to see. This one here is early treatment efficiency. So did it work or it didn't work? Red is it didn't work. And this one is early treatment cost. Red is really expensive and blue is cheap. So purely the left one, let's look at the left one with my mouse. Red didn't work. Let's look at these countries for early treatment efficiency. Now, unfortunately, I'm an Australian. I have to say, didn't do very well. Now, who was bringing in these choices of treatments, and did they work? Australia, you didn't do very well. Europe, you didn't do very well. There's some parts of Africa. South America, Canada was a little better, but America was terrible. Now we can scroll down, and then I'll go to the right. COVID early treatment cost. Now, Australia, you wanted to spend the big money. I guess there's some financial interest for certain organizations pushing those to adopt those. I'm not quite sure. Maybe the cheap ones like zinc or sunlight may have been missed, but the costs were extremely high and the government was happy to foot that bill. And the same in America. In Africa, some of Asia was the cheaper alternatives. Now, if we scroll down here on the left, we've got hydroxychloroquine was mentioned early on, very safe. Ivermectin was very safe, but it was unfortunately banned in Australia and told it was a horse dewormer, etc. Well, anyway, let's learn from our mistakes. Now, what about, there's some other pharmaceuticals. Lactoferrin is in some probiotics. That was early, obviously was a cheap one. Vitamin A is not listed there. Vitamin C, oh brilliant, so available, easy to get, just I'm sure any country you're in, but it was adopted. And what this shows, where are the countries? I think I click up here. I wanted to click on the USA. That's right, I wanted to click on Australia. And to show you, so Australia, these official medications, pharmaceuticals, were adopted countrywide. Now, if we click on, there's no natural things, there's no mention of sunlight, there's no mention of vitamin C, there's no mention of those things that I showed you previously that were actually effective. Masks were pushed, and these drugs. Now, if we look at something like remdesivir, let's click on it and see. It was actually worse than control. It increased ICU admissions by 119%. Ventilation, more people were put on ventilation because of this drug. Mortality, 1%. Viral clearance didn't do anything. Now, that's pretty scary for me. If you really want to see the data, you can drill into this page and look at the research, specifically with these drugs. I'm not saying it's a conspiracy theory. I'm not saying just off the top of my head. It's right there, hard data, facts and figures. Even something like ibuprofen, negative. Increased ventilation. Now, naturopathically, we talk about the importance of fever, talk about all those mechanisms of the effect of the inflammation cascade and the importance of the inflammation in the body. So when we bring in with children or adults with something like this, it's not always the best thing, and it often makes things worse, as the data shows right there, especially for early. So late, yes, there was a positive, but early on, maybe you should question, do I really need it? does my child really need it? I'm not making the call there, you are, but I would question right here. The data shows that early intervention with this medication, choice of medication, is not going to help. It's going to make it actually worse. Let's pick another one, but they're all the same, unfortunately. So this particular drug is causing a lot more harm. You see all that red against control, caused much more harm. Now, what's done is done, but I'm not going to get into accountability and all of that because it makes me angry. But what we need to learn, the title of this live was, what do we learn and what can we learn for wellness? I've gone through a lot of the natural substances, which I love and I've been using for almost 25 years with patients, and they have shown to be effective. A lot of African countries and Asia use these. Did Brazil use any? It's maybe not listed here, but a lot of those developing countries, they were forced because they didn't have the money to spend. People went, I know India used a lot. India used the zinc and vitamin C, and they gave it to everyone. Government distributed it. It was 6 years ago, I can't remember, but they knew that zinc and vitamin C worked and it was more effective. Where is this one? Zinc. Who used that on my screen? Was Bhutan. But a lot of countries did use them, and they were generally the developing countries that couldn't afford, so they went the route of what they knew worked, and at least they gave that option. Whereas in Australia, they just pushed all of that aside and said, no, these are the drugs that work. So what do we need to learn? We need to use these, and synergistically we can improve and prevent hospitalization and worsening things. So of course I'm promoting natural things because in my heart I believe and I know and I see positive results. The other things we need to learn is possibly we have to question what our governments are saying, just based on this evidence here. They don't always make the right choices. Choosing my words carefully, because who knows, my channel might be suddenly banned, or as it was back in 2020. But if we use the data and we make decisions in the future, we need to question what we are told as being the best thing. It's not always the best thing. So I think I'll end it there, and I hope that you found this helpful. And I will see you in the next live stream.